Yes. Yes, I have. I don't know about the rest of my crew.
No matter. Chili, pardon me, Harinder, man. How you survive till 10? Simba? Well, I don't know. Maybe if you see me without my cam on later, then yeah. How's everyone? How are you guys? How's your day? Tired? It's okay. Hopefully this talk can cheer you up, Mel. Happy day. Wow.
Yeah, we'll just give a few more minutes before we'll start the meeting,
Yeah,
the event.
yeah.
How's my physics? It was great. Man.
Exam season there. Yeah, right.
Exam season. That is right. Hi, Mel. Wow.
Yeah. What about you, Emran? Are you happy today?
Yeah. I think I'm very happy. It's been a really good day.
Nice.
Sorry, Mel. Unfortunately, we have faced some technical difficulties, so there is no music.
Okay. You know what? Let's just begin now.
Right now, is everyone here?
Yeah.
Maybe you can play some music. No.
Maybe someone sing lah, because I cannot share music. Someone sing, bro. JK. Anyways.
Okay, we're starting now. Okay, everyone ready?
Yep.
All right. Good evening, guys. Welcome to Psychology Behind Mental Disorders. Okay. We'll start off by introducing ourselves. Hi, guys. My name is Adrian, and today I'll be hosting the event alongside my friend.
Hi, I'm Myra, and it's our pleasure to be your host for today. So first of all, we would like to thank everyone for taking your time here to join us today. And TLBMC has collaborated with Taylor's Connect to bring you this event, Psychology Behind Mental Disorders.
In addition to that, we have invited Mr. Brendon Ban, an honored psychology candidature at our very own Taylor's University, and a member of the Diversity Research and Appreciation Lab, as well as Dr. Harinder a HRDC certified trainer and mental health doctor from Vibes Healthcare, to have a sharing session with everyone in attendance tonight. I'm sure this talk will be very informative and useful for everyone.
Then alongside that, since this is quite a heavy and sensitive topic for tonight, we've decided to host a small Kahoot giveaway session at the end just to lighten things up a little. So on your screens right now, there should be the list of prizes that are up for grabs tonight at tonight's giveaway session. And Carol, I think it's the next slide. Yep, there you go. Okay, so here are all the prizes that are up for grabs at tonight's giveaway session. You get TLPMC's very own club merchandise alongside some freebies. So do make sure to keep your eyes and ears peeled to try and win the prizes.
I can't wait to see who's going to win the prizes later. All right, guys, the flow of tonight's event will be firstly a talk by our wonderful guest speakers, followed by the Kahoot giveaway session, and then finally we'll end it with a Q&A session. For everyone to clarify any doubts that you may have, please feel free to type your questions in the Slido link provided in the chat box. Kindly refrain from typing your questions in the Zoom chat. Thank you.
Yep, and lastly, last thing before we begin, some housekeeping rules which our moderator has sent in the chat box. So kindly adhere to them, because if they aren't, our committee members will not hesitate to remove you from this event. As well as, okay, due to the topics discussed tonight, if anyone needs to, you can just join the breakout room named Safe Space, just to take a breather, take a break from everything that's being discussed and calm yourselves down. So this breakout room is open all the time, and you guys can just hop in and out and whenever needed. So there is a PCB or peer counseling buddy who will be in the breakout room as well if you guys need anyone to talk to. Now, that's all, and without further ado, I'll pass the floor to Brendon to begin his session.
Okay. Hello, everyone. Can you guys hear me? So I guess I need to share my screen, right? There we go. Can you guys see my screen now?
Yep, we can.
Yes.
Yep. Okay, so it's very nice to come back to Taylor's Lakeside Pre-Medical Club again, another year, like to speak as a speaker again. Yeah. So I think this year, the topic that you guys are covering are quite intense, which is this psychology behind mental disorder. And I do realize that you guys actually do the marketing and mention that there's mental health professionals that actually going to share insights. I just have to put a disclaimer here. I'm not a mental health professional, but I'm actually a mental health advocate and also a researcher that do research on mental health and well-being. So do take note on that, yeah, for the attendees. So I'm Brendon. As like what the hosts have shared, I'm actually a current researcher and student at Taylor's University. And yeah, you can see in the slide, there's some of my affiliation to the organization that I'm working with, yeah. So right now, we'll go a bit on the agenda, which is basically to cover in this session. So we'll be covering a bit on what is mental disorder, because I guess you guys have been flown with the topic, like the title. So I think I need to cover that in my session. And then we'll talk a bit about like the common mental health issues that students are facing right now, or like what I mean, like the prevalence of mental health issues that most undergrad students facing. And I'll be also share a bit on my research that give you guys a bit of insight about comparing the medical students and also psychological student data. So keep excited on that. And also I'm going to cover up the session with a little bit of tips like how to manage your mental health well-being as a student. Yeah. So I think to start a little bit, I'll give you guys a bit of appetizer, right? So which is the mental disorder. So when we talk about mental disorder, based on the World Health Organization, it actually states that it is actually a pattern of thoughts, feelings, or actions that actually deviate and distressful and dysfunctional. So when we talk about disorder, it's actually referred to a state of mental or behavioral kind of ill health. That is mean the disorder here. And when we talk about the patterns, it's mean that it's referring to the finding of a collection of symptoms that tend to go together and not just seen as a single symptom. They do come with several other symptoms that in a chunk like that. If let's say you look into the DSM-5, and for that to have the distressful and dysfunctional, this symptom, right, it has to be sufficiently severe and interfere one's person's daily life, like it affect your kind of like day-to-day kind of like livelihood. Then that is only called the distress and dysfunctional. And I think there's a very I saw word there, right? Deviant, the word deviant there, right? So the word deviant is actually means to like, it's differing to the norm. So it means that like what you're actually doing is abnormal and against the norm that in the community or the society. So I think this is basically how the WHO define mental disorder. All right, so now we know about the mental disorder. As a psychology student, I think it is interesting to bring this model and to give the attendees to know like how does each of the aspect of this element do play a role in the mental disorder or psychological disorder. So in this biopsychosocial approach, we actually look into three circles, which is the biological influences, the psychological influences, and also the social cultural influences. So when we talk about biological influences, that could be the hormones, it could be the brain development, it could be also due to the gene, the genes. Whereas the psychological influences, it could be like the stress that you have, the trauma that you experiences, and maybe some sort of like mood-related kind of perceptions, and also some of the memories that you have prior your childhood or like throughout your experiences growing up. And in terms of the social cultural influences, it could be like the roles or like the expectation that you have, and also like the definition of personality and the disorder. Whereas like today's session, we cover a bit more on mental disorder, right? So the mental disorder can be actually arises from the interaction between each of these components. Like it could be from the bio part, it could be from the social part, it could be from the psychology part. And also don't forget about the environment and also culture, all right? Culture and environment do also play a big role in terms of the mental disorder, because what happened in Japan, it wouldn't happen in Malaysia, or like what happened in Indonesia, it might not happen in Malaysia. So that also play a huge role. So now you guys know about the interaction between these three elements. Then you guys might be wondering like how mental disorder actually onset, or like how does it come into your life? So in psychology, there is a model called the diathesis stress model. All right. So to make it more simple, like take away the model, take away all this fantastic, like, all this glamorous name, we just think it like imagine like you have a cup of water, all right? Now it's an empty cup of tea. And imagine like all your emotion and all your feelings are filling up this cup of this glass cup. And when it comes up to the top of this glass, it will just flow out. So it is basically like you are bottling up the entire cup and then you explode. So this is how the diathesis stress model actually trying to explain. So like what I mentioned just now, like the biological aspect, right? So some of the individuals, they might have some sort of like genetic kind of vulnerability. So maybe they do have like, like some sort of cases that their parents have depressions, which increase the likelihood of them, in this cup. So maybe a quarter of the cup is already have filled. And then maybe like they actually experience some sort of stresses or life event in their life, which then add on to the cup. So when the cup do not have extra spaces, which then the mental disorders start to onset. But you must be wondering like, then is there any way to like identify the symptoms and etc.? I mean, there is way to, but which is we will covering more later on. Yeah. So I will say that if you see this like person one, like they have the tendency to have to drink, then if let's say they're actually experiencing some sort of like activating kind of event, like they have like a broke up with their girlfriends, then that actually increase the likelihood to use substance to immune themselves. So that is why like they fall into like maybe depression, feeling anxiety, feeling loneliness, and being isolated. Yep. So this is the diathesis stress model in very simplified kind of way to explain. All right. So I think I covered a little bit about like the psychology kind of like the behind. So now we're going to go in depth about like the common mental disorder that students actually facing. So they actually have three that I think are quite common, which is the first one is a mood disorder, which is also known as depression. The second one is called as the anxiety disorder. And the third one is eating disorder. So in the DSM-5, this mood disorder, they actually have a lot of others subcategories. So it has like major depressive, and then there is like bipolar disorder. And for anxiety disorder, there is like GAD, generalized anxiety disorder. There are SAD, social anxiety disorder. There's phobias and etc. So there are a lot more of this disorder in each of the component. If let's say you are going to look through the DSM-5, which is the Diagnostic Statistic Manual for this psychology or psychiatrist. So now I will cover a bit on mood disorder, but today's session is not about telling you like the symptoms and etc., but just going to cover a little bit to touch a base on like what is depression is. So depression is actually more than just feeling down, and also it's more than just feeling sad about something. So if let's say you think that depression is like just sad and etc., that is not just that, because they actually have other symptoms that need to be qualified in order to consider that as a depression. So the other symptoms will be like the significant increase or decrease in appetite. So you can see yourself that maybe eating a lot of things, or like you have reduced in your appetite, or you feel that like you're no longer like your usual day, which is like you're feeling that you are very less energy, like very fatigued nearly every day. And whatever that you do, you can't find the passion. You feel yourself that it's very worthlessness, or like you feel yourself, you have the excessive kind of like inappropriate guilt. And there are many more that actually classified in the DSM as a symptom of depression. And a lot of time, people actually say that depression is actually AKA the common cold that we actually go to the doctor. Yeah, like you have a common cold, you achoo, you have a sneeze, then you just go to the doctor and get medication, right? But depression is actually more dangerous than that. I mean, dangerous than common cold, because there is an association between depression and suicide risk. All right, that is the first point. And the second point is because depression has fewer kind of observer kind of symptoms. A lot of times, right, clinical psychologists or maybe clinicians, they need to run different kind of assessment or battery to only able to identify that you actually diagnosed on depression. All right. And third is depression is different from cold. cold will go away itself after a few days, but depression is lasts longer than cold, and it will not just likely to go away just with time. All right. Despite the fact that depression is not contagious, but the depressive pain is actually beyond the sniffles. Like the 𝑗𝑗 that you have is way more irritating than the sniffles, I would say. Yeah. And to understand more about the mood disorder, I think the organizer have asked me to cover a bit more on in terms of the social cultural perspective. So in terms of that, we can say that depression could be associated with like you feel helplessness, you have low self-esteem, and you will start to have those kind of depressive kind of explanatory style. And also you will start to ruminate on things. So when we talk about learned helplessness, it's mainly like you self-defeating on your belief, such as like you're assuming that your own self is unable to cope, to improve, or to achieve, or to be happy. So you will start to have that feeling. And then in terms of low self-esteem, it's like basically you were discounting on your positive side, and you're assuming the worst side of yourself and the situation and the future. So this is basically on the low self-esteem. And then in terms of the depressive explanatory style, it's like you basically will try to analyze the bad news predicts mood. Yeah. So like, for example, you will predict like, yeah, so like I broke up with my girlfriend, like what's next and what's next. And based on that, you will create like different kind of like chronological of the stories, and it makes you more like just sad. Yeah. And then lastly is the rumination part, which you always look into this focusing on the bad side, which is like you were just dwelling into the black hole of yourself, that thinking that, I'm being isolated, like you ruminate on the things that always keep on, like it's like a recording tape that keep on going and going and going. So I hope this actually gives you a little bit of insights about like what is mood disorder and depression, because we are going to go to the next disorder, which is anxiety disorder. All right. So I think anxiety disorder, sometimes some individuals might have a confuse on when comparing stress and anxiety. All right. I have to say that stress is not a disorder classified under the DSM-5 under the anxiety disorder. But what we are doing here is we try to categorize or comparing like what is the differences of stress and anxiety. So when I talk about stress, it is much more on, it's a response to a recognized threat. But for anxiety, it may not have an identifier kind of trigger. So stress and anxiety are actually naturally part of our fight or flight response, if you have learned this. And why we need this? Because that is the body reaction that we're trying to react to the threat or the danger that we are facing. And the purpose of this response is to ensure that you're always alert and focused and ready to deal with the threat. So when someone actually feels under threat, right, their body will release a lot of stress hormones. So whereas you can see in the stress there, you can see that you will have like moodiness, irritability, or anger, and then you will start to have a bit of loneliness and dizziness, nausea, initial of thoughts, a feeling of overwhelm. And then for the anxiety part, you will feel like restlessness, you'll feel tenseness, you'll feel sweating, you'll feel nervousness, and you'll have a feeling of unease or dread. But the common point of this stress and the anxiety is basically on the fast heartbeat and also the fast breathing. Why does that? Because the stress hormones in your body will cause the heart to beat faster and resulting into more blood pumping to the organs and the limbs. Therefore, you will experience this within the stress and anxiety. All right, like if, let's say, you do happen to come across anxiety. All right. And the next disorder that we'll be covering, I think is pretty not very well versed in Malaysia, but it's a growing disorder currently, which is the eating disorder. So basically, this may actually involve with the unrealistic kind of body image that we want to achieve, and maybe like the extreme body ideal that we actually see in Instagram, Like when we scroll the Instagram, we start to see pictures of those artists, like they are so skinny, they have the S line and etc. We want to try to achieve that. So that is how is that? And also eating disorder is like more like a desire to control your food and the body when one situation can't be controlled. And it doesn't just stop there, but it also relates to the cycle of depression. And besides having just the mental health part, it actually will cause a lot on the health problem as well. Because if let's say you're going through like anorexia, bulimia, or binge eating, that actually will cause damage to your throat. Or if let's say you are taking some sort of like medications or like laxative medication, that will also put more harm to your body. So when we talk about anorexia nervosa, it's basically about compulsion to the lost weight, coupled with certainty about being fat despite being 15% or more underweight. So that is basically anorexia. And for bulimia, it's basically you have the compulsion to binge eating in a large amount, like in a fast period of time. And then after you have the food already, you will go to the toilet and push yourself and losing the food through the vomiting, laxative, or extreme exercises. All right. And lastly, for binge eating disorder, it is a compulsion to binge, and followed by you feel that, why am I eating so much? Then that is the part that you will fall into rumination, and that is the part that is the tendency, or there will be a risk, to fall into depression. All right. So I think all of you here sitting down here will be like thinking that, Brendon, you're like a robot, like you're telling me a lot of things, and like having Dr. Harinder here as well, you will think that, wow, you guys learning to treat crazy people. Like I think all of you here will be thinking that like we are here to treat crazy people, but I think that is a very wrong perspective. All right, guys, because like imagine if when you are sick, or even like when now in the COVID pandemic, like you guys will actually do your swab test when you feel like you are not right? You feel like you're coughing, you feel like I'm having a headache, I'm having a diarrhea, then you will go to a pharmacist to purchase the COVID test to do the test. So why does people actually so reluctant in terms of like seeking for psychological help? So here, which is I want to share a bit on my research. All right. So in last year, my team and I, we actually conducted a research to basically to understand about like to look into the social connectedness, like basically how is it important for emotional well-being, like from friends, families, and also their neighborhood. And then we also look into like the empathy. So empathy is basically like we try to look like would there be any associated with individual to desire to help. And then for the dependent variable, we actually look into like their willingness to seek for medical help and also to look into the psychological help. So so far in the research, we actually in Malaysia only have been conducted among the general undergraduate. So that is the reason why we conducted to compare these two particular group, which is a psychology and medical student. And of course, there are other covariates that we look into it, because when we talk about stigma, a lot of medical student or psychological student, they will think that mental health issues, it sounds like I'm weak, but I'm a doctor, I'm a psychologist, but I seek for help. Like, is it right? Something like that. So that is a stigma part, right? And then the next part will be like, because there's a very limited studies on pandemic, so therefore like we thought it would be interesting to look into like this kind of studies. And then we also look into like, would actually positive feedback or positive response from people around that seek for medical help and also psychological help will increase the higher chance for seeking the help. So we actually look into this as well. And we also look into like the social responsibility, because like medical students have a lot of social responsibility. You need to contribute back to the community. Same goes to psychology students. So they will probably neglect their own health problems. And this, based on the studies, it actually a norm already for like medical and psychology students to actually neglect their own medical and also psychological health problems. So what happened in our study, what we did is like, we tried to look into all these variables, and then we did find participants from undergraduate, from private and government, and 18 and above, and it has to be like from the psychology medical programs. And then yeah, and now we actually have like 103 psychology students and also 107 medicine students. All right, and what actually we found is basically there is no significant difference in terms of willingness to seek professional help during the pandemic. All right, I think this is pretty obvious because pandemic, like medical help, like when you're sick, then you just go and see doctor. I mean, that is common sense, right? But then interestingly, for psychology help, medical undergraduates were more reluctant, which is those that attending this talk, the future doctors here. It might be one of you have filled our survey. You feel that reluctant, and it actually fit the finding of the past research because it actually say that it is the weakness, a weakness to seek for psychological help. And it also stated in the literature that they actually more reluctant, all right, more reluctant when they become doctor. And this is actually very alert and it's very alarming. Therefore, that's the reason why I bring out this in this talk. And you can see that like actually for psychology student, they actually will have more willingness to seek for psychology help, whereas the medical student, you see, is a bit lower, all right? All right, then what other thing that we found? Actually, we found that pandemic have significant positive correlation with the empathy and also their willingness to seek for professional medical help, which is, I think, that is quite common sense. Pandemic, medical health, yeah. But the other relationship with other variables, it was actually insignificant. But one thing is like the stigma to seek professional psychological help is not actually reduced, all right? Which then we actually look into it and we saw that actually when we have the increased social connectedness, which is mean that they will have more significant kind of like willingness to go and seek for psychological help. All right, you can see that the number is like 0.39, is quite high as well. And this actually fits the findings of the past research as well, which is like when you have like supports or emotional well-being from your family and friends, then there will be a likelihood for you to go and seek for the health professionals for help, right? And then if let's say that particular individual have shared some sort of positive feedback, then the chances for you maybe to go and see for a psychological help, then that will be increased because they have a good experiences of like having that kind of like services, am I right? Like the therapeutic kind of experiences, then they will continue to go there. But what actually stated in the literature is mentioned that the knowledge that they gain, right, it has to be very close relationship, which is like your close friends or your family and like your immediate families, this kind of like relationship, then it will be much more stronger for that particular individual to seek for the professional psychological help. And then what else that we find is basically empathize. Actually, the empathize this part is basically will have a strong relationship between to seek for the professional psychological help. And then one thing that we wanted to state here is like there is a significant negative relationship between the empathy and stigma, because I think probably because they are actually fear on the discrimination part, like fear of being stigmatized within the very high professional group of people. And then they also have a significant difference in the empathy score between the medical and psychology undergrad. So it could say that like psychology students are more empathized than medical students, despite the fact that medical students might have more, the clerking, like, rounding the ward and etc. But I would say that empathy can be something that trained and strengthened, and this is actually backed up by the research. So this is not something that you need to be concerned, but what the message that I want to deliver here is like, start to build up your empathy. Yeah, start to build your empathy, and that maybe will actually change a little bit on your perspective on seeking for help, like, medical help or psychological help. And you must be wondering like, why Brendon are sharing so many things, and like, is there any way that I can do like like for now, like right now, like is there something that I can do like to solve my current problem? Then I would say that the first method is definitely to start to journal. Personally, I started to do some journaling because I think this is a quite easy way that to work on. So basically, you just gather about your feelings, your thoughts and moods. You write it down, and then you can also include the timestamps. And then like, how do you feel? Like, do you feel happy? Do you feel sad? And etc. And maybe you can write more context. Like, you can go and reflect back, like when you're writing the journal, what are the activating event, or like what are the things that triggered you to have this kind of like feeling, like being sad. So maybe like your friend have said something like words that have triggered you. So maybe that word, then you can state it down there, like this actually the word or the pattern of the thoughts that actually have the tendency for you to fall into this kind of like behavior. And then after you actually saw the pattern, then you can maybe start to cope with the pattern. And then in the future, maybe one day you will sort of like immune, or maybe like you will sort of like being persevere when someone actually start to irritate you with the trigger that you are not very very into it. And the other option that I think is very simple, but most of us, we always neglected, which is to practice mindfulness. So mindfulness could be very simple, as in like just doing a breathing exercise, like just sit down here, like sit down with me right now and just breathe. Like when you're breathing, you can actually like listen how your heartbeat like pumping yourself, like how your body actually sweating, and how your entire skin is actually connecting to the nature. Because mindfulness is more about like you're trying to reconnect back to the environment, the nature, and also you're trying to basically be more present, I would say, like be more present to feel how it is. All right. So I think that will be actually one of the ways that you're able to recharge yourself, and also a way for you to get away from all the things that you are very how should I put that? Like you're very stressed off, like you're very tired of, sort of like you just recharge yourself again. Yeah, recharging yourself again. And I think the last one that I want to share is like, don't try to have the psychology student syndrome. I know all of us right now, we are quite convenient and accessible to the internet. And oftentimes we will try to scroll like the WebMD, you'll go and scroll like Mayo Clinic, right? To check like, am I depressing? Am I anxiety? Am I OCD? Am I PTSD? Yes, if those symptoms that you have, yes, it might like sound that you have that mental disorder. But mental disorder is not as simple as you think. It is a lot of very complicated component, like what I mentioned previously, the biological aspect, the social aspect, and also the psychological aspect as well. So if you really want to go for like really being diagnosed, I would say you should go to a proper channel, which is to seek for the clinical psychologist, or clinical psychiatrist, or medical doctors, or even like we can actually go and see for our CCS, Center of Counseling Services in Taylor's, which is free. Yeah, so you can actually go there and actually ask for help, like psychological help, right? But I think all these are things that you can do. But one thing that is quite available to you right now, which is your friend. So when I talk about friends here, it's more on like your parents, your very close friends that you can share about like how you feel, or like maybe your neighbors that are very close to you. This could be your good friends, all right? So you need to have friends that you can actually channel your real feelings, your real thoughts with them. So if let's say you have this kind of support from them, I would say that friends actually a very good medicine, not to cure, but at least there is a channel for you to go and share about how you feel. Because like what I mentioned just now, the diathesis stress model, if let's say the cup actually fill up, then that is the part that you start to onset. But imagine if let's say you start sharing, you start to like having a good chat, yeah, then that is the part that will slowly, like, you are reducing the cup. The water is like keep on flowing down and flowing down and flowing down, and you will keep on having the empty cup, and the cycle will just keep on going and keep on going and keep going. So it means that it reached to an equilibrium that it will not explode, or like it will not fill up and fill, just keep on continue and fill and fill and fill and fill and fill and then just explode. So I will say that having friends, it will actually brighten up your day, because you're able to get some sort of like advice, suggestion, and you can have fun with them as well. And they will give you different kind of perspective. And at the same time, I will say that having friends like that, you can grow together and live together. So I will say that friends is a very huge component do play in your part. But when choosing your friends to share about this very intimate or very privacy kind of context about how you really feel, I think that is the part that your wisdom and wise have to come in, which is like you need to know which friends to share and like what to share, like how much do you disclose. And how I usually do that is like basically I will test the water, which is like I try to share a little bit of my contacts and etc. and see whether like do I hear any stories from my other friends that talking about the story that I've shared with him or her like that. So I think you can try this kind of method. And if let's say this method doesn't work for you, then I think you can seek for like the option, which is clinical psychologists or the CCS counselors. So basically, I think I have covered most of the thing in my slides, but I have some key takeaway for you guys for this session. So we can actually willing to seek for medical help. Why not we can seek for psychological help? So like what I mentioned in my research just now, it's all come with the stigma regarding the psychological help. But if let's say you remember in my research sharing just now, I did mention that increase in social connectedness, increase in the positive feedback, and also like maybe you learn how to be more empathy, that will also increase the chances of a person to seek for psychological help. So I think this is the key message that I want to bring out here. And also, if you realize just now, I did not actually bring out like, like having CBT kind of like, how do you do CBT as a person? But I would say that you should take one step at a time. If you think that journaling doesn't work for you, try mindfulness. And if mindfulness doesn't work for you, then maybe try to seek for psychological help. And if all this doesn't work, then you can try to work with your psychologist and maybe the counselor and see what are the other way that you guys can explore. So don't give up. I know the journey will be a bit, it's a bit hard, but all in all, if let's say you do actually build up this kind of empathy, I will say that empathy, it will actually shape someone that who you are, because empathy is actually a quality of a character that could actually change the world. And looking around the demographic that in this room, most of you are from the medical field, from the psychological field, or maybe like, doing related to health. And I think that this quality or this value, it is a need, as an individual. So I guess that's the end of my part. And so thank you so much for listening to me. And if let's say you want to connect with me, you can connect my LinkedIn or Twitter. So I think I'll pass it back to Adrian. Am I correct?
Yes. Thank you so much, Brendon, for the very informative and very interesting presentation. All right, so without further ado, I'll now pass the floor to Dr. Harinder to begin their session. Harinder, you may share your screen.
Yes. Can you all see?
Yes.
Okay. So hi everyone. I'm Dr. Harinder. So today, how's everyone today? Okay, so today I'll be talking about management of mental health disorders. Okay, there are actually around 200 types of mental health disorders that exist, and each mental health disorder got different presentation. So just now, Brendon have I think covered few of them, and also each mental health disorders, it will improve, it can improve with treatments. Okay, so today my whole topic is, I'm going to cover about the treatment. Okay, and then I want each and every one of you all to understand what kind of treatment is available. Okay, there are some certain people, they don't really know, they think that only medication is available, but there are a lot of other treatments like psychological treatments that is available currently. Okay, so this is my outline. It's very simple. Okay, management is, I divided into pharmacological and psychological. Okay, pharmacological is more to pharmacotherapy, and then psychological is more to psychotherapy. So before I move on to this slide, I would like to ask each and every one of y'all here, have y'all ever felt that, you're sometimes, you're depressed, you're feeling stressed, or you have some kind of anxiety attacks, but you are unable to tell it out to someone, and even if you tell it out to them, you feel like they do not really understand what are you going through. Okay, so this is actually a real life scenario happened. This is what actually one of my patients, she told me that she's been suffering for the past 1 year. She's been suffering depression, and at the beginning stage, she was having this kind of just minor depressive symptoms. And what she did was she tried asking her friend or her family member that she thinks that she's having all this, and what they told her that you do not need medication. All you need to be is, you need to be more motivated to cope with your mental health. Okay, so actually in this current era, we still have people who are stigmatizing against mental health. So what she did, it took her 1 year to realize that she's actually having mental health disorder. And then she, even last month, she was trying to suicide and all. Fortunately, thank God, she did come to me, and then we did discuss about what are the treatment available. And she didn't want to even get medication, because she thinks that if she start taking medication, people will label her as psychotic. Okay, so we still have this kind of mentality in the society. So if at all if at all you think that medication is not going to help, we do have psychotherapy as well. Yes, I do agree that psychotherapy and pharmacotherapy combined will be better. But if at all, like, there are certain people who don't like taking medication, so we will usually just treat them with psychotherapy. Okay, so a little bit about the pharmacological part. I'm not going to cover the whole mental disorders. It's just the common that I have seen among students. Okay, so depression, mood disorder, like how Brendon have presented just now, and anxiety disorder. So the medication that is available, okay, this is a little bit brief. There's only 4 cycles. The first one is tricyclic. Second will be monoamine oxidase inhibitors. Third is selective serotonin reuptake inhibitors, and there are other antidepressants as well. So currently we are using SSRI more often because it's safer and lesser side effect. Okay, the reason why, you see, tricyclic, we don't really give to those have heart problems or those with thyroid problems. Okay, it's contraindicated. And then for monoamine oxidase inhibitors, it have a higher side effect, and usually the side effect will cause muscular pain and all. So usually this is SSRI is the best option. Okay, I will also cover a little bit about anti-manic. That means students that having bipolar disorders. Actually, currently bipolar is also very common in students. Okay, so the medication that's involved is lithium valproate and carbamazepine. So that's all for the medication part. Okay, and then so I'm going to go into psychotherapy. Okay, what I mean by psychotherapy in my own definition is more to a talk therapy. Okay, This is the real definition: a process which attempts to help the patient to relieve symptoms, resolve problems, or seek personal growth through structured relation, okay, with a trained professional therapist. Okay, what I mean by trained professional therapies is either it will be counselor, clinical psychologist, or a psychiatrist. Okay, and usually psychotherapy, right? It will help to eliminate or control troubling symptoms. Okay, and then it will help to function better. So psychotherapy actually it can help few problems. Okay, it can handle a lot of problems like trauma, okay, any past trauma and all, and then anxiety, depression, medical illness like chronic pain, or even difficulties in coping with daily life. Okay, psychotherapy really covers most of it. So this is the common one usually psychotherapy will cover. So types of psychotherapy, who do we do psychotherapy to? Okay, we do have individual psychotherapy, we do have couples, family therapy and all. Okay, and there's actually a lot of psychotherapy, types of psychotherapy that is available. A lot of them, but I'm just going to cover a little bit, some of them only, the one that commonly used. Okay, so there's three types. There's one cognitive and or behavioral therapy, and there's psychodynamic type therapy, and the third one is supportive therapy. Okay, so all this is taken from a Oxford Handbook of Psychiatric. Okay, if you want to know further about the psychotherapy, you can actually buy that book and read about it. So this is the very common cognitive behavioral therapy, which is commonly used currently, okay, in our mental health setting. Then we do have acceptance and commitment therapy, dialectical behavioral therapy. Okay, and we do have like few more REBT and all. Okay, cognitive behavioral therapy is like an umbrella. All is ACT and DBT is actually under this umbrella. So I'm going to be explaining a little bit about CBT and ACT and DBT. So what this cognitive behavioral therapy is indicated for is mild to moderate depressive illness, eating disorders, anxiety disorders, bipolar, substance abuse disorders, psychotic disorders, chronic medical condition like chronic pain. Okay, so I'm going to go into cognitive behavioral therapy. Okay, what is cognitive behavioral therapy? It relies on behavioral technique, but adds a cognitive element, focusing on the problematic thoughts behind the behaviors. Okay, I'm sure many of y'all will not know what cognitive behavioral therapy is going to be. So cognitive is actually relates to the process within the mind. Okay, what kind of process? Can be imagination, your thinking, memory, decision making, and mental processing of concentration and information. That is cognitive. If behavioral is, it relates how people respond to and engage with themselves and also others. Okay, behavioral actually describe actually what someone does, more to like your behavior. Okay, and then therapy is an approach that is placed significantly to improve negative or destructive thoughts, okay, in a professional manner to improve your situation. Okay, so as you can see on your right hand side is that there's thought, behavior, and emotion. All of these are interconnected. Okay, your thought and your whatever you think and whatever you feel will cause a disruption to your behavior. That's what CBT means. Okay, so here it said what we think affect how we act and feel. Behavior, what we do affect how we think and feel. And emotion, what we feel affect how we think and do. Okay, this is interconnected. So this is my next will be an example. Okay, this is a case that I can give an example of how CBT is conducted. Okay, It's an event a friend does not call when she said she would. Okay, that's what happened. And then automatically there's a negative thought that came into her that if her friend did not call her, that means she thinks that she's a loser. So that's a very negative thoughts that coming into her, which automatically will cause emotional response, which is the sadness. And then it'll cause something to her behavior. So you'll start avoiding friend. She'll be as isolating and worsening of her mood. So at the end of the day, she will be depressed. So what CBT does is that we change the negative thoughts to a positive ones, and then we will stop the emotional response and maladaptive behavior. So it's a simple example that I've given here. Overall, that's what CBT does. And then we do have acceptance and commitment therapy. Okay, what is acceptance and commitment therapy? It emphasizes acceptance as a way to deal with negative thoughts, feeling, symptoms, or circumstances. Against, I think rather than fighting or dealing with your guilty or feeling guilty with your own situation. Okay, there are 7 core processes that is used in this ACT. Acceptance is the first one. Be willing to experience difficult thoughts. Okay, acceptance is an alternative to your own instinct. Okay, which to avoid thinking about negative experiences. Okay, and then it also it's an active choice of you allowing yourself to feel this unpleasant experience. Okay, and you don't without changing it. Okay, from my side, acceptance means that you are acknowledging your own thoughts. Okay, that's what in a very short term. Okay, it's just acknowledging and embracing it. So there's diffusion. The second core process is diffusion. What diffusion means that it's a technique to change how an individual react to your feeling, to your thoughts. Okay, how do you react to your own thoughts and feeling is to observe your own thoughts. Observing is very important. Then the third one will be self as context. See yourself as unchanged by time and experience. Okay, commitment, the fourth one. Take action to persuade the important things in your life. Okay, how you can take action is set a goal. Okay, when you set a goal, you can see where are you leading to. Okay, and then expose yourself to difficult situations, difficult thoughts, and difficult experiences. Lastly is, develop some skills. If you really want to take action, try to develop some skills so that you can handle your thoughts. The fourth is values. Discover what is truly important to you. The sixth, being present. Focus on the here and now. So this is what acceptance and commitment therapy. So later I'll be showing you a table of 3 of them combined together. So dialectical behavior therapy, it is utilize both behavioral and cognitive technique to help people learn to manage their emotion, cope with distress, and improve interpersonal relationship. So this is the core processes, usually DBT, how we use this technique. We use mindfulness. I think just now Brendon already explained what is mindfulness means. Okay, it's actually being more present, being more focused. Okay, so some what you can do is that you can stay calm and stop engaging or reduce all these negative thoughts in you. Okay, so what kind of exercise that you can use to be more mindful is that meditation is one of it. Okay, close your eyes and then feel your breath, and then try to take note of the sensation, which is breathe in and breathe out. Okay, that is one kind of exercise you can do for mindfulness, which you can do at home. Okay, this one we don't need to teach. And then the second is distress tolerance. Okay, so there is few techniques that is available lah. You can do for distress tolerance. Is first is distraction. Okay, and then thinking pros and cons. Yeah, that's few. Self-soothing is one of it. Okay, what kind of exercises you can do for distress tolerance is that, for example, if you are sitting, if you are at home, okay, try to go out. If you're thinking so much, go out, do something else. Or you're sitting at home, try to go up, okay, and walk around. So that is allowing your emotion to, I would say, stop your emotion. Okay, allowing your body to feel that emotion lah, basically. Okay, and then there's one kind of distraction you can do lah for your emotion. Okay, and then the third one will be interpersonal effectiveness. Okay, be assertive in a relationship, being able to say no. Okay, what we can do is learn to communicate and listen effectively. Okay, respect yourself or respect others. This is what we actually teach in this therapy. And and then emotional regulation. How you can regulate your emotion. Okay, navigate powerful feelings. Okay, by navigating your powerful feelings in a effective way. Exercises, like common exercises, usually I'll tell to the patient how to regulate your emotion is that you can, for example, if you're feeling sad and you don't feel like seeing your family members, so what you can do is just you make a plan to see them. Okay, do something opposite. Opposite, what are you feeling? If you're feeling sad, go out, do something. If you're feeling you don't feel like seeing anyone, make plan to see them. So this is how you can regulate your emotions. Okay, this is what we do in this DBT. So this is the differences basically. I have combined it in a table form. Okay, CBT more to a faulty thinking leads to disturbance, which is corrected by learning. If ACT, mixed acceptance, mindfulness, commitment, and behavior change strategies. Okay, and then DPT combines CBT with Buddhist meditative practice, just like mindfulness and all. Okay, key concept for CBT problems rooted in childhood but reinforced by present thinking and core beliefs. If ACT, problems rooted in experiential avoidance and cognitive entanglement. If DBT, emphasize psychosocial aspect to manage arousal level by support-oriented, cognitive-based, and collaborative therapy. Okay, the goal is to confront the faulty belief and change the automatic thinking. If for ACT, it guides to contact with self as content and accept and choose alternative. Okay, more to acceptance lah, basically. DBT is stabilizing, achieving behavioral control and non-traumatic experience. So what kind of techniques we use in CBT is structured cognitive, it's called cognitive behavioral therapy, plus emotive techniques. ACT, mostly the technique that we use is acceptance, okay, and embrace the problems and events. DBT is more about learning the skill, okay, like how I explained just now. What is the limitation that we go through in CBT is that client dependency, okay? It's not confrontational, it's structured, little focus on past. So CBT, we don't really focus on past, we are more to present and all. Okay, ACT is more to behavioral, okay? It doesn't address any underlying cognitive process, okay? DBT, treatment stability, client expectation and differential effectiveness is questioned. So this is the very simple, you can see the differences between CBT, ACT, and DBT. Okay, so the second psychotherapy that I'm going to go into is psychodynamic therapy. Okay, what is psychodynamic therapy? It's aimed to produce changes in the individual thinking and behavior by exploring childhood experience, the unconscious mind, including transference and the quality and the nature of the relationship in the past, present, and the here and now with the therapies. So in psychodynamic, we use 3 techniques. Okay, it's called free association, dream analysis, transference, countertransference. Okay, what is free association? Is that okay, for example, usually what I do is that if patient, okay, free association means that whatever the client is telling to us, whatever comes into their mind, they will tell it out, okay, without filtering, without even thinking how embarrassing it's going to be, or how illogical or even culturally inappropriate. So that is free association. So whatever comes into their mind, they will tell it out. Okay, I can give an example. For example, I have a client called, his name is Bill, and he has some marital problem and all. So what I do, free association is, what usually we do is that, like, we do tell him what if he said that, if what is his meaning for wife. So wife for him is mine. He will say mine, and then if wedding, he will say he will say promise, and then husband, he will say power. Okay, so that's free association, that whatever words that we told him, that is his meaning. So in his way, that he thinks being husband is something that he's very powerful and all. Okay, so that's how we do free association. So dream analysis also is like repressed feelings, okay, that it will reflect in your dream. Okay, whatever is depressed, okay, and then you will be dreaming about it. Okay, an example, okay, this Bill again, he's been dreaming about this. He is digging a hole, and then he's trying to bury something, right? And then when we ask him what is hole mean to him, he says it's endless. Okay, what is he trying to bury? And then he says failure. So we use free association also to ask about what is happening to him. So this is the few techniques that we use in psychodynamic therapy. And then we have the third one will be transference and counter-transference. Transference means that means the client will transfer their feeling to the therapies. Okay, that is their feelings, their past feelings to the therapy. Counter-transference is vice versa, where the therapy will transfer their feelings to the client. Okay, so this transference and counter-transference, you can see example in YouTube. Okay, it's a very good role play done in YouTube if you want to understand further. Okay, but usually counter-transference really don't recommend, because for therapists, they will usually say that you don't have a boundary towards during that session, and then you tend to say your own personal life and all. Okay, it's not a good therapeutic session will be. Okay, so the limitation usually is we cannot really do psychodynamic towards mental retardation. Okay, and then severe psychopathology like psychiatric, some kind of schizophrenia and all. Okay, the third one will be supportive therapy. Okay, I think the word itself says supportive. Okay, usually psychiatrists, they will use this therapy. Okay, it's just an emotional support. Okay, and then patient will be telling their problem, and then all they do between psychiatric and patient is that they will just discuss how to solve it. But psychiatric will not go into the underlying core problem. Okay, they will not really see what is the cognitive part of it, or even what is the defense mechanism and all. So it's just a simple therapy. So that's why it's all covered into 3. The first one, like I've mentioned, is this one, cognitive and or behavior therapy. Second will be the psychodynamic therapy. The third will be supportive therapy. So in my center, my experience using this CBT, okay, I have patients that will ask me that, can I get better in one session? Okay, so of course you will not get better with one session, because CBT sessions itself will take at least 10 to 15. Okay, so it's not a quick fix therapy. But if at all you want to be better faster, yes, you can with the help of medication. And then professional trust and respect is very important. If the client don't have a trust on you, it's very difficult for us as a therapist to even ask a lot of questions or even to gain any information from them. So also the experience that I use when I use this CBT is that they must be actively participating. I have clients who are very, very timid, like they don't really say much. They only say 1-2 words. So even the session will take very long if you're not actively participating. So this is a few experiences that I get when I'm using this CBT. Okay, so I think this is end of my slide. Thank you so much. It's very short, and I hope everyone understand. And if you, any one of y'all have any questions, do I think after the questions we can have a Q&A session.
All right.
Okay, I pass the floor.
Yep. Dr. Harinder, you can stop sharing your screen. Okay. So thank you, Dr. Harinder and Brendon, for this enlightening session. So I hope that everyone has learned something new from both their talks, respectively. And now I'll pass off the floor to Adrian to start us off with our Kahoot giveaway session.
Hi guys. How was the session? Wow, that was a really interesting talk. All right, moving on to the Kahoot session. Okay, we will now be sending Kahoot link to the chat. You can click the link or key in the game code to join the session. Have fun, everyone, and try your best to win the prizes.
Wow, who is Sean's babe? Wow. Damn. Wow. Oh, Amnesty level wait. Wow, siapa nih? Sean's babe 2. Who is this? Hey, people. Hey. Wow, Adrian, you joined the. Wow, okay. I want to see Sean's babe 3. Who? Nice. Bro, hey. Wow. So funny, you guys.
So, wow, so many couples here, so many babes.
So many lovers and
It's like Sean's and Abner's babes and lovers are the most popular one here.
Ayo. Wah,
Oh
okay.
no, Sean
Wah,
Babe 3
betul
also.
ada. Hey. Wah, Sean. Harem, you got harem, is it? Wow. Apa ni? What? Hello? Hey. Share some dating tips lah, bro. Don't know that. Hey. Some bromance going on in the chat box. Hey. Wow. Nice.
Okay. Oh, okay, there's more Sean's Babe joining. Okay. Give everyone another minute to join, and then we'll start the game.
Sean's homie, wow, like. Sean Ying, you win already. Share some tips. A lot of singles here, lah.
Okay. Sarah, can you start the game?
Let's go, let's go.
Okay, first one, start off easy. True or false question, guys. Who's the 4 that got that wrong? Oh my god, guys.
All right, you
First-
guys will get it right for the second question.
First place, 𝑻𝒂𝒚𝒍𝒐𝒏𝒏𝒆𝒄𝒕. You guys gotta beat them. Whoever.
What are the common mental health disorders found in Malaysian college students, guys? Wow.
It was answered just now, so. This really tests whether you're listening or not. Only 9 if you got it right. Damn.
Nice, nice. Oh,
Oh, Sean's Babe, the original, is the highest climber now.
Wow, Sean's babe, Abner's lover. Good job, Abner's lover. When facing panic or anxiety attacks frequently, they should just let it be because it will eventually go away. Yeah, I think that's a
Yeah,
really
right?
good answer. We should let it be. That's right, guys.
And then
It's blue. It's blue.
just died. Good people.
Good. Okay, nobody
Endless
listened.
lover. Wow. Macam yes.
Sean, your babes are not doing well.
Some people may feel hungry all the time or maybe.
Who's that one person?
Oh, Martin. Oh, well, you're admitting you're one of the babes. I see. Wow. I see. Fighting.
All the Sean babes are fighting for first place now.
If
Interesting.
you'll win Sean's attention. Right. Yeah. Hey, wow.
Oh,
And then I love the confidence, man. Thing. Wow. Wow. Siapa ni happiness lover? Macam ni saya.
The love for Abner is too strong. Most common eating disorder, guys. Wow.
I think this was covered in the presentation just now.
Mm.
Sean's babe cannot be seen for now.
Yeah, I don't know what happened to my babes. They're all gone.
John, your plan's not working out, man. You gotta try harder.
Aish.
Those three of you.
Wow.
Sean, really, all your babes and lovers all gone already. Yeah.
But I'm just lovers really doing well. It's on the street.
This one, any A-level students know all the answers.
Oh, 100%. Finally.
We have a clear winner already. Like.
Come on, double points. Y'all can do it. Where's my babes at? Double points can climb up. No,
Redemption period, guys. Redemption period.
exactly.
Partially correct. I.
A one though.
Adrian's favor. 来了来了。
5 more questions left. Anybody wants to redeem yourselves? This is your chance.
Oh no. Wow, both of 𝑻𝒂𝒚𝒍𝒐𝒓'𝒔 lover. Top 2.
Wow. Nice.
Oh, Chang has overtaken.
Wow. Shang is catching up, guys.
Shang, as in Shang-Chi. Just kidding.
Maybe just Shang. Well, Mel, you know.
You never know.
REBT was designed too.
Come on, Adrian's babe, I believe in you, whoever you are.
Don't let Asian down. God.
Don't let me down.
I'll tell you
I
the
think
answer.
your one all lost hope already. We are not even in the top 5. Sad lah.
Ish. Hey, Sean's babe is
Let's
out.
go.
Oh,
Adrian, your babe went off the charts already.
No!
winning your attention tonight. Ish. Mental
Mental illness interferes with a person's occupations, daily tasks, social and family relationships, all of the above. I mean, it's pretty clear, right? Yes.
Let's go.
It's not just
Adrian,
about
where's your lover? Where's your babe?
It's okay. They try.
Second last one, guys.
double points again. Come on.
Alright, at least you tried, you know. You can just like get me, I'll still give you a topic.
Hey.
So
What is the most effective treatment for most mental health?
ignore the
disorders?
problem. Let's go.
Definitely.
I
Do,
mean-
guys.
Ignore the problem. It's just in your head only. Ignore the problem.
I mean, just forget about it, right?
Yeah, what is mental illness? Huh? I don't know who she is.
Right.
Smart people.
Yeah,
listen
never
to the
ignore the
host.
problem.
Oh, Adrian's face back. Let's go.
Let's go.
Oh.
Oh.
Last one, guys. Let's see who will jump up to leaderboard this time.
Last question.
Hey, smart people.
Oh.
Smart
Let's
people.
go, 100%.
Y'all listen.
Okay. Let's see. In third place, we have
𝑻𝒂𝒚𝒍𝒐𝒓'𝒔
lover 2.
Congratulations,
Wow.
I'm just lovers too.
Shang.
Chang
Hey.
at first
First
place.
is 𝑻𝒂𝒚𝒍𝒏𝒏𝒆𝒄𝒕. Who is it?
The original one.
Who is it? Come out.
Sure, we can.
Who is the first place?
Yeah, like give say few
Abner,
words.
you
a
must
bit.
be so proud, Abner.
Is Simba?
Is it Simba?
Wait.
Simba, are you number 1 or number 2?
Oh,
Let's
nice.
go.
Wow. Who's the 𝑻𝒂𝒚𝒍𝒏𝒏𝒆𝒄𝒕 lovers number 2? Who's that? Show yourself. Who that? Alexander. Wow. Nice.
Good job, guys. So that was a great Kahoot session. So we hope that everyone here had fun as well. So yeah, congratulations to our top 3 winners. And winners to obtain your prizes, you can get in contact with Adrian through WhatsApp, and his phone number will be placed in the chat box now.
Guys, let's take a moment to congratulate the winners. Congratulations, 𝑻𝑳𝑷𝑴𝑚S Lover 1, 𝑻𝑳𝑷𝑴𝑚S Lover 2, and 𝑚𝒂𝒚𝒍𝒐𝒓'𔂏. Congratulations, guys. And we'll have a memory of this event by taking a group picture. We would like everyone to turn on their cameras and give us your biggest smile. All right.
Turn on your camera, everybody, for a bit. I want to see who's the face of 𝑻𝒂𝒚𝒍𝒐𝒓'𔂏. Wow, lanh trai mình băng. Wow, 难怪有 lovers 啊，难怪啊，原来如此是这样的。Okay, cool. No wonder have lovers. Memang ada fans. Cannot relate. Anyways, where's the others? You are beautiful and handsome too. Like, show your face. Don't set. It's okay. You can win it next time. It's okay. Cheer up, Martin. Cheer up. It's okay. Nice romance in the chat box. So sweet.
Okay. Tara, can you take the pictures, please?
Okay, in the count of 3. 1, 2, 3. Okay.
Thank you, everyone. Once again, congratulations to the winners. Let's go. Woo! All right.
Yeah, that was a lot of fun. So now we can proceed with our Q&A session. So everyone, the Slido link will be sent in the chat box once again, and you guys can type in all your questions there for both our speakers, Dr. Harinder and Brendon, to answer.
Yep, that's right, guys. Go key in all your questions.
Oh, got a question ready.
Wow.
Mr. Brendon Ban. Wow, so formal.
Okay. Yeah, let's go with the first question. Okay, so this one doesn't specify who. So what if we don't have the money to seek psychological help from a medical professional or even get medication to help ourselves? Dr. Harinder, perhaps you can answer this.
So what if we don't have the money? Okay, so we usually, if you don't have money, we do have, like you see in government, they do free psychological assessments in clinic kesihatan and all, and then even you can get free medication from government as well. So it doesn't mean that you need to go private. Okay, there's a lot of others, maybe NGOs, even NGO is available to do all kind of assessments, and then to give medication. So yeah, and also tailors itself, I think you all have counselors, right? Free. Just now I think Brendon said that you all can go to the counselor.
Sure. Okay. So you guys, whoever asked that question, that's your answer. You don't your health doesn't necessarily have to cost a lot of money. Now, next question. So what if the source of my depression comes from a problem that cannot be solved? Example, mentally abusive or suicidal family. I don't know who would be more suited to answer this question. Perhaps Dr. Harinder once again.
Okay, so this is a very difficult question. Okay, I do have patients that come from a very abusive family. So usually what I do is, yes, I do give them a CBT. Okay, that's the only thing that we can do, is that we change the way they think. Yes, the core problem you definitely cannot solve. It's either you go out, if you're staying in the house, same house with them, the only way is that you come out from that situation and then change the way you think. This is a really very, very difficult situation. Some of my patients who is facing all this. So I would say I have given medication. I have given a lot of therapy sessions to them. And yet I have patients who are still not out from this kind of depression yet. So what we do usually, it will be long-term medication therapy treatment. I have patient who is still 60 years old, still on medication due to this abusive family and all.
Yeah. Yeah, that is kind of a tough situation. So you guys you have to listen to the doctor's advice and do your best to survive in that scenario. Now, to both Dr. Harinder and Brendon, so what motivates the both of you to stay and pursue your career path?
So I'll go first. My motivation is more to listening to my patients. Okay, the reason why I chose this path is that I think that I can help these people to get appropriate treatment to feel better, because you see now in this era a lot of mental health is very stigmatized. Okay, and not a lot of them knows and afford, they cannot afford this kind of expensive treatment. Yes, you can go to government, you can go clinic kesihatan, but the time to see, it's very long. When I was in government, usually to get appointment for a psychiatric patient, it will take at least 6 months. I think by that time they will be already killing themselves. So that's why I chose this path, is that as far as I can help them, I will definitely try to help them. That's my answer.
Okay, I think I'll go
Next question. How to improve your empathy?
Adrian, Brendon hasn't answered yet.
Oh, Brenda has answered. Okay, sorry, Brenda.
Okay,
You may proceed.
I think for my part, it's like, I guess it's much more on like my passion towards like psychology. Yeah. So how should I explain that? I guess while you're doing research, or like when you're having this conversation with people, like especially like when dealing with like mental health issues, like when your friends share, like my friends share with me, I find that I'm quite fond with all this conversation. Like it's not about like solving their problems, or it's not like about giving advices or suggestion. It's more on like lending a listening ear to listen about their issues. Yeah. So I think that started me more. I feel that like it's very fulfilling to hear stories, and sometimes like I'm able to see like my friends actually going from a point A, which is like very sad, and at the end of the day, like after the conversation that we had, like he or she like smiling the face and say goodbye to me, like in a good way, like instead of like still ruminating or like feeling depressed. Yeah. So I think that is the most fulfilled part that still keep me motivated, yeah, to stay in this career and maybe in the future. Yeah.
Thank you, Dr. Harinder and Mr. Brendon, for answering the question. Okay, next question. How to improve your empathy?
Yeah, so I actually expecting this question because I didn't cover this in my research part. And yeah, I do expect that like there's a question for this. So in terms of like improving your empathy, it could be just as simple as like, visiting an old folks home, like like your unconditional, like providing love and support to the people. Or like it could be just a very genuine kind of very simple way, which is start to listen to your friends. Don't give judgment, like put those away, like just listen about people. And slowly you'll realize that like you're actually building up the value of this kind of skill, which is like being more empathized on others. Because like when you do listen about people, like you start to develop some sort of like empathetic kind of like skills. Because like you need to be very, how should I say, like you need to start to be more like, it's not analyzing, but it's much more on like the part that you will start to listen, and then you'll relate their feeling like that. Yeah, and you'll start to put yourself in their shoe. Then that is how the way that you slowly build up your empathy. Yeah, empathy is not because I think some have like the confusion between empathy and sympathy. Sympathy is like basically you're just feeling like, I feel sorry for you like that. But empathy is not like that. And empathy is much more on like you really unconditionally like, providing the help and support the person. So this do take time. You don't expect like, I just go to the OFO phone like, for 2-3 times, then I can build up my total empathy level in yourself. It do take years or maybe take months to develop this particular, skills. Yeah. So back to you, Adrian.
Next question. Will constantly dumping your problems to a friend lead them to have mental health disorders?
Maybe I can start first. I think if let's say your friends really want to listen, that means that they are opening their heart to listen about your issue. I think that is the part that you shouldn't concern about the mental health disorder that will cause and lead them, because they actually openly wanted to listen the problems. But if you do actually concerns about like their mental health, I would say that aren't you like creating another problems for yourself? Like, I mean, like you need a space to vent out, right? So I would say that they're actually providing you the emotional support. But if you do not take the emotional support, aren't you are the one that rejecting their support? I mean, like this is the way that I'm trying to reframe like the question. So for me, it's like they do know the boundaries and they do know like what to do, like from my point of view when I'm reading this question. So if let's say they feel that it is too intense and it is affecting their mental health disorder, I think that person will back off and they also will get a support that they needed. Yeah, I guess from my point of view reading this question. So maybe I can pass it to Dr. Harinder to share her perspective. Yeah. I think Dr. Harinder is muted.
Dr. Harinder, are you there?
Oh, hi, so sorry, I was talking to my patient. What is the question? Sorry, is it this one? Will constantly dumping your problems to a friend lead them to have a mental health disorders? Okay, usually, from my point of view, it doesn't really. When you dump your problems to someone, it's a very good coping mechanism where you can let out everything. Because sometimes when you keep everything inside you, it can lead to a lot of problems like anxiety, panic attacks and all. And to those who are receiving the other end, yes, you need to know how to control it. Okay, you can take it from your friend who is having all this problem, but you can't bring it back home and try to think again and again, okay, this person is having this problem, am I going to be affected to it? So yeah, not from my side, you can help your friend who are having a mental health disorder, but please do not think too much. Helping, yes, but not taking it back home. So sometimes when you are also, when you're, you see, most of us, we will have these mental problems, okay? Either it's stress, okay? Stress is the common word usually we use, even if we are in the jam, we use that we are having stress and all. So if you are having all that kind of symptoms in you itself, and then you are trying to take problems from someone else, you will also can go into this mental health. So it's either here or there, basically. Depends from your end how you receive it.
Okay. Thank you, Dr. Harinder and Mr. Brendon. Following, the next question is, if I am mentally unwell, what can I do to avoid affecting others around my poor mental health?
Okay, so if you're mentally unwell, this is what some of my patients, they think that if they are mentally unwell, they will affect others. It's actually not. Like how I've said, that if you're not well, you have to tell it out to someone, so that everything inside you is taken out, okay, instead of you keeping it inside yourself. And then how you want to avoid, I don't think so avoiding is the best word to be used. You should avoid if you're mentally unwell. Okay, if you're having depression, it's better to tell out to someone that you're having depression, so that someone can come and help you. If at all you are not well, and then you are going to suicide and all, there's no one going to know that this, you are facing this kind of issues in you. So for me, you should not avoid, okay, with your poor mental health and all. You should not avoid. You should tell it out to people that you have depression. Yes, it's very stigmatized currently that, to tell out that you have depression and all. People might not understand, okay, but it's okay. It's okay if you tell people that you are depressed, then you're keeping it in yourself. So I think I've answered this question.
Okay. Brendon, do you have anything you want to add on?
I think for my side is you never assume that that will actually affect, or like it will actually whatsoever, because I guess like what I mentioned in my slide just now, like actually like mental disorder is not something that you can just easily be invisible, like how COVID, like you have symptoms like very obvious, like headache and etc. But for mental disorder, it is a lot of like underlying conditions, or like there's a lot of other symptoms that associated with each other. So I would say that like what Dr. Harinder mentioned just now, which is like seek for support first, because that will actually leading into like knowing what is the issues, because like you will go through a lot of like assessments, having conversation and therapy, and that only we can know like what is the exact root cause, and then leading into like having a treatment plan for you as well. Yeah, I hope that answers the question. Yeah.
Okay. Thank you, Brendon and Dr. Harinder. All right, moving on. The next question is for Dr. Harinder. Could you tell us your educational pathway to becoming a psychologist and advice to those who are interested in psychiatry or becoming a MD?
Okay, so so I'm actually medical doctor, okay, and I am currently in the process of being a psychiatric as well, doing my papers, and also I did my diploma in CBT. So that's how my pathway is, because you see, in psychiatric, to be a psychiatric, right, we will not really know how to counsel people and all, counsel our patients and all. We will know only the pharmacotherapy part. So what I have done is that I want to also give them medication and together do this psychotherapy that I've mentioned. I think I've talked this now. So that's my pathway to become a psychiatric. And becoming a MD, I think it took me 5 years to study to be a medical doctor. After that, I did my housemanship, and then I have attached in psychiatric for 5 years, and now I have my own psychiatric center.
Thank you, Dr. Harinder. I think the next question is also directed towards you. So, can professional healthcare providers get mental health disorders from their patients' issues during psychotherapy?
Professional healthcare. Okay. I from my point of view, we do. I mean, I do get affected sometimes. Okay, personal view. I'm not sure about others, clinical psychologists, other counselors, and all. Okay, we do sometimes get affected by the things that our patients tell to us, the things that they gone, right? Sometimes it's very bad, and it did affect me first few times, and then I think once you are already in that profession for years, then you will know how to actually handle it already. So it wasn't an issue for me after that. It's just that first few encounters with the patients, I was having difficulties and all, and then over the years I was okay. So yeah.
Thank you, Dr. Harinder. I think the next question is also kind of related. So, how would you say about the process and also effectiveness of hypnotherapy or hypnosis in psychotherapy to treat conditions like depression and anxiety?
I am not really sure about hypnotherapy. Okay, it's usually what I know in my centers, what my what clinical psychologists who are experienced in hypnotherapy, what they do is they will what you call that? They will check. I mean, they will examine your subconscious mind and all. Okay, it about how effective it is, I have not seen a very good result in hypnotherapy. Some patients, yes, but not all. Okay, like depression, anxiety, this hypnotherapy is more about it's doing assessment of your subconscious mind, I guess. Yeah, I think that's about it from my point of understanding and all.
Okay, thank you, Dr. Harinder. Now, this next question at the top, is psychology in university hard? I think, Brendon, you can answer this.
I think there's no any subject is easy. Despite the fact that you're studying business or account, it's actually not easy. So we shouldn't say that this psychology is easy or not, because I guess like the courage for you to go for our courses, it do require a little bit more courage, like to go and explore like why you want to do this career, or like why do you want to take up this course. So I would say that there's no any like easy or difficult course. It is the matter of like, are you interested? Do you have the passion? Is it something that it will bring you like 20 years, 25 years later on? Yeah, because to me, it's like work is something that it integrated to your life, or like it's integrated into what you are doing in your personal day-to-day. So whatever that happens in your work, what happens in uni, it will affect your overall well-being. So yeah, there will be sometimes that it sucks, sometimes it's good day. So I would say that, yeah, sometimes it's hard, sometimes it's easy. So it depends on how is my thought process. Yeah, how is my thinking, like how Dr. Harinder said, like how do we feel, how do we see things, yeah, and etc. Yeah. So I hope that answers the question.
Okay, thank you, Brendon. Now this next one. Advice we can give to suicidal friends or how we should interact with them in general. I think both Brendon and Dr. Harinder, you guys can answer this.
I think for me, right, when you're dealing with suicidal friends, try not to give advice, all right? Try not to give advice because one thing is like, you don't want to take the blame because like when you give advice means like, I'm not trying to say that you are backing off, like not helping that person, but you need to know how to protect yourself first. Yeah, no matter how good are your training and etc. I will say that there's a need of precaution, like in terms of the boundaries. So I think advice, if let's say you really have like crisis management kind of like, experiences and skills, then sure, you can go ahead and give advice. But if you are not well trained, not well versed, I would say that provide them the support, give them the resources that they can reach out to, like what Dr. Harinder said that, like there's counseling or like, psychiatrist services at the government. There's also like NGOs. So maybe you can help them to collect or compile those numbers or like those websites and provide them. And in terms of like interacting with them in general, I guess just be more sensitive. Yeah, try to be more sensitive and try to put yourself in their shoes. And prior to like having the conversation with them, normally what I would do is like, I would try to observe, like, is there anything that would actually cause injury, like harm to the person or like you yourself in that particular environment. So I think that is the first thing that you need to do first, like make sure that there is no any sharp knife or like there is no any poisonous substance. Yeah. So I guess this is the first thing that you can do, which is like try to observe your environment. Like where's the escape room, not escape room, where's the escape exit, yeah, the doors and etc. Yeah, so I think that is the most important thing when interacting with suicidal friends. Yeah, maybe I pass it to you, Dr. Harinder.
I agree what Brendon has said that advice, we can't really give advice. It's better to give just a spot saying that this kind of help is available. Please do seek, or you can also help them to bring them to the centers, to the hospitals. Okay, but interact with them. You can ask them how are they feeling. Like you can watch out for the warning sign that they are really going to suicide. If you think that they already collect some certain medication, if you see in their room or in their house that they're trying to buy medication, and then you see this kind of warning sign, you can actually call the helpline, hospital helpline, to tell them that this person is trying to suicide and all. That's the way you can help them. But advice, yeah, like Brendon said, we have to have some boundaries with them.
Okay. Next question. Why do you think there's a stigma around seeking psychological help? I think we can, I think, Brendon, you can answer this question because you're presenting about it just now.
Okay, I think from my study on my literature review, I think the part that actually cover a lot on this is like more on the public stigma and also the self-internalized stigma. So when we talk about public stigma, it's like we actually, we actually sort of like give a frame that like, how Brendon look, like he is, smart, he looked perfectly fine. So like there is a society norm that, like when you look normal, then it means that you are normal. And that makes people like, stigmatized and feeling scared to seek for psychological help. And because of the public stigma, that will make you also to have the self-stigma, which is you will start to think that, as a medical student, as a psychology student, I have these identities already. Like I need to portray that I am strong enough, which then led them to feel that, nah, I shouldn't seek for help because I can help myself, which then make things more worse. So I guess within this society, the two things that I would say that will actually prevent them or like stopping them to seek for psychological help will definitely be the two stigma that I mentioned, the public and also the self-internalized stigma. Yeah. Over back to you.
Okay. Dr. Harinder, do you have anything to add on?
I think Brendon already answered the question.
Okay. All right, we can move on to the next question. Any advice for dealing with one's mental health?
advice that I can give those who are dealing with mental health is that if you don't help yourself, there's no one else can help. Okay. Yes, there's medication, but do come for counseling and all. Okay? Because sometimes psychotherapy really can, really can open your eyes. Or even if you think that you don't have money, you don't feel like going to any trained psychotherapists and all, you can actually do you can help yourself at home, like how Brendon, I think, have said just now, that journaling is one of the best things that you can do. To see your thoughts written down is something different, then that's how you can actually change the way you think. And also medication and a few other things that you can do at home to deal with your own mental health. I think over back to you.
Thank you so much, Dr. Harinder. All right. I think this will be the last question. When does a psychologist decide on CBT over other treatment types, and to what extent does it work?
Mostly right now we are using CBT. Okay, CBT really works for depression patients, for most of it, all other mental health disorder like I've presented just now. So if at all CBT doesn't work, then we will think about other psychotherapy that is available, or we'll mix REBT, CBT and all. And yes, I have seen patients who did when I did CBT on them, it did worked in after 10 sessions, a lot of them actually. So CBT is actually very good. It's a cognitive behavioral therapy. So what we do is, like how I explained, we change the way their thought process, okay, and then that's how automatically their behavior will change. So I think I've answered that question.
Thank you, Dr. Harinder. Brendon, do you have anything to add on?
On which question?
The question Dr. Harinder just answered.
I think in terms for that, like in the psychology point of view, like there is no one therapy works the well, or like works the better, like for each of the presented mental disorder. Because during like their master programs or like in their PhD programs, they actually have the practicum and internship. So they will actually learn all this kind of like skill sets, and they will actually adopt like which are the well words that they think is much suitable for them and also their client, because they will undergo like 1,500 hours for internship, like to learn all this CBT, REBT, or like way more like psychodynamic treatments skills. So I would say that it really depends on the psychologists themselves, like what are the therapy that they really want to use. Yeah. And also, does the therapy actually suitable to the particular client or the patient? Yeah, so it is really case by case basis. Like from what I learned in my module, like psychotherapy, that is what I'm being taught, which is like there's no a single skill set that is customized for the mental disorder. There's not such a thing, which is like we really do case by case basis based on the client. Yeah. Yep. Back to you.
Okay. Thank you so much, Brendon and Dr. Harinder. Actually, we still have a little bit of time left, so maybe we can answer like one more question, one or two. Okay. Any advice? I think we answered this one already. Sorry, can you guys scroll down? How to seek mental health treatment if you're under 18 and parents are unsupportive?
Yeah, maybe I can go with this first. I think to seek mental health treatment, if let's say you're under 18, I guess I'm sending a whole bunch of lists here. So basically, they're actually a psychological first aid or crisis helpline resource sheet that actually actually compiled by a very nice association, Malaysian Association of Psychology Students. So they basically compile like 2 pages of poster. I think you can actually try to provide this to those under 18, and I think they do have access to mobile phone, and they can get support from this kind of like telehealth, psychological health, because most of them they are free, and then they do cover like a various diverse language like Tamil, English, Malay, and Chinese. So I think these are the first thing that they can work on, and then maybe after that, if let's say if their parents are really not supportive on that, then maybe the particular counselor or like the person, the responder, could assist to help out with this, because under 18 is like minor. But I believe there is one of the channel is called I can't recall what is the name. It's like something like Bear, something like Buddy Bear Childline. So that is basically for those children. They have a children helpline that assists those under 18. Yeah. So I think this will be the first option that maybe they can try first. Yeah.
Thank you, Mr. Brendon.
I just want to tell my little bit about my experience. Patients who are under 18, right, and their parents are unsupportive, I do receive a lot of calls from them saying that they do have like mental health problems and their parents are not helping them. So what they do, they will just call me, and they just need someone to talk to. Like what Brendon can share all the things that is available. Yes, for that. Okay. And one thing is sad about them is that the parents, when they are not supportive, they cannot go out and ask for help. So what they do is that some of them just die in their early age, like they will try to suicide and all. So this is what little things in my center that I face. Okay. And hopefully, when the mental health is not too stigmatized and the parents is supportive. Why parents are not supportive nowadays is because during that era, they don't really believe in depression, don't really believe that anxiety do exist. So now when the students, the children are telling that they're having anxiety symptoms, they're having depression, they what they do is that they will just look at them and say that, you just need to go and sleep and just go and do something that, occupy your mind. So, those who are under 18, it's very, very, it's very sad basically to see them, nobody is helping them. That's what one of my experience that I do have. I do get from my center.
Thank you so much, Dr. Harinder and Mr. Brendon, for answering the questions. Hopefully, we managed to answer everyone's question. Unfortunately, the Q&A has come to an end. But if you have any questions, you can feel free to stay back after the event, or you can email us using the emails in the chat box. Once again, thank you so much, everyone, for joining Psychology Behind Mental Disorders. We hope that this event was very helpful and informative for you all. Remember, guys, mental disorders are not something that you should just ignore and put away. If you're going through a tough time, please reach out and find help. There is no need to suffer alone. Right? You can go look for people like CCS, all of the places that they've mentioned just now, Mr. Brendon and Dr. Harinder. Thank you, guys.
Yeah, mental disorder is not something to just ignore and put to the side. So now, in the chat box, we will be sending out the feedback and attendance forms. So make sure you fill that in to prove that you've attended this event. And if you have any feedback, please do put it in the feedback form. That way TLPMC can get to know our audience better and improve on our future events. Also, do make sure to follow our social media pages, our Instagram, Facebook, and YouTube, so you can stay tuned to any future events that we will be hosting.
All right. Thank you, Maya. that is all, guys. Unfortunately, the event has come to an end, everyone. We sincerely hope you all enjoyed this event. Thank you so much for participating, and you may leave the meeting.
Thank you,
Hopefully,
everyone.
you guys have gained a lot of insight about psychology and mental health. Thank you so much, Mr. Brendon and Dr. Harinder. Bye, guys. Bye.
Bye.
Bye-bye.
To all the abnormal